let's talk about surgical abortion methods. As opposed to medical abortion, you need to go to a health center. Surgical abortion methods are considered as minor procedures practiced by doctors, nurses, or midwives. You cannot do it on your own, and you must make sure to consult a skilled healthcare practitioner. There are two types of safe surgical abortion methods: vacuum aspiration, manual or electrical, and dilation and evacuation. Manual vacuum aspiration, MVA, is the most popular surgical method of abortion for pregnancies up to 14 weeks of gestation. The gestational age limit for MVA often depends on the clinic, as well as the healthcare provider performing the procedure. MVA is performed by a trained healthcare provider in a clinic, usually under local anesthesia. During the procedure, the clinician uses a silent handheld suction device, manual aspirator, to remove the pregnancy from the uterus. The procedure usually takes between 5 to 10 minutes. After the procedure, the recovery time is on average 30 minutes. Some clinics might require that you go home escorted by a friend or relative, but it is not mandatory. While MVA is safe, adverse effects still happen in less than 2% of cases, including heavy bleeding, infection, or injury to the uterus. Electric vacuum aspiration, EVA, is another form of uterine aspiration and is often used on 10 to 15 weeks gestation. It is very similar to MVA, the main difference being the source of the vacuum, an electric machine rather than a manual aspirator. Because the EVA requires electricity, it may not be available in low-resource settings and is noisier. Finally, dilation and evacuation, D&E, is commonly used beyond 14 weeks gestation. The availability of D&E, like other methods, depends on the legislation of the country you live in. It's a minor procedure practiced by a trained healthcare provider, usually under local anesthesia. Prior to the evacuation, your cervix is dilated with the administration of dilation agents, usually several hours or days before. Once dilated, the doctor will evacuate the pregnancy. The procedure generally takes between 10 to 25 minutes.